Thank you for being here.
Oh, no, Luis, I thank you for having me. I want to thank everybody for joining us this afternoon for the Medicare Supplement Insurance, how to pick the right plan and get the best rate. What I'll do is I'll sort of give you a little background on Weiss Financial Ratings and Gray House Publishing, which is the companies that I work for. And I'll give you a little background on myself so you get a better idea on where these references are coming from. So Weiss Financial Ratings has been around for over 40 years, providing buy, hold, and sell recommendations for many financial instruments. They also give financial strength ratings for banks, credit unions, and most importantly, insurance companies. And they also offer this Medigap supplemental pricing tool that if Medicare supplement insurance is appropriate for you, could definitely save you a ton of time, can definitely save you a boatload of money. And you know what? You have some great choices that are available. Also, I always suggest going to the Weiss Financial Rating database that is provided to you by the Three Rivers Public Library System. They feel it's a fantastic resource for their patrons. And we also have a tab, which is the Financial Literacy Suite. So, if you want to really pick up some great books, they're PDF file books that you could download, print, or read online that are absolutely fantastic, and those are updated on an annual basis. I also work for Gray House Publishing. Gray House Publishing has been around for over 42 years, providing print reference material for libraries across the country. I do need to let you know that both organizations do not manage any assets, nor do we own any assets. Therefore, any of the information that we are providing to you today will absolutely, without a doubt, be independent, unbiased, and as accurate as possible. Now, for me, myself, I am a wealth manager for over 33 years now. And about 3.5, 4 years ago, I decided to pump the brakes and sell my practice and trade in working for very demanding clients to really working with wonderful librarians like Luis, which is a complete 180. And I would also, before I even get started, I always have to raise my hand for the reference librarians there. Know this: if you ever need any information, you ever need to be pointed in the right direction, please use your reference librarians. They're a great resource. And if they don't have the exact right answer for you, they will point you in the right direction to get that answer as well. So, for me, myself, again, I thank you for your time. And today we will be going over the Medigap pricing tool and insurance ratings. Now, I am not an expert in Medicare. I want to disclose that right off the bat. Do I know enough to be dangerous? Absolutely. I will actually point you in the right direction for the people that are the experts in Medicare, and those are our ship counselors. And I'll show you how to get in touch with one of your local ship counselors because they live and they breathe Medicare all day long. Okay, so this Medicare Medigap discussion is designed to help you navigate through the Medicare maze. Our primary goal is to tell you about the choices you have available to you and help you save as much money as possible. At the end of this conversation today, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies at the least amount of money. And you can do it all for free as long as you have one of those Three Rivers Public Library card. And if you don't have one, I highly recommend that you visit your reference librarian and get one. Here's some of the things that we're going to cover today. One of the things I want to get right out off the bat is we will discuss Medicare. We will discuss things that what Medicare covers and what we as consumers are responsible for. We will also talk about Medicare Advantage as well as the Medicare Supplemental Insurance. I will mention some names here and there of organizations. that is not an indication that you should bind insurance or run from binding insurance with any of these organizations. They are just being used not as hypotheticals, because the numbers that I pulled are exactly as of today for these organizations. But I am in no way making any recommendations today. We're going to cover major expenses that Medicare does not cover. When is open enrollment, and what does that actually mean? Why Medigap can be better than Medicare Advantage. I want to repeat that sentence. Why Medigap can. It doesn't say it is. It can be better than Medicare Advantage, and in a lot of cases, it is. How to get lower premiums, save hundreds, even thousands of dollars. One of the nice things is that when you live in a metropolitan or the suburbs of a metropolitan area like New York or Chicago, it's usually we're saving thousands, not hundreds. Well, when can you join Medicare? Well, it's a common question that always gets asked, and you have a 7-month initial enrollment period, and it typically is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Now, the open enrollment period is October 15th through December 7th. And if you're still working and covered by insurance, just know that Medicare can supplement your employer coverage as well. When can you change your plan or your insurer? Seems to be a common question that's always asked. When we first start Medicare, and let's say we want to use the Medicare Advantage plan and we feel it may be enough for us. For some of us, maybe that travel abroad a lot, maybe that's not really meeting our coverage needs and we want to move to a supplemental insurance. Well, just know that we can change our plan or our insurer anytime during that open enrollment period each year between October 15th and December 7th. And that new coverage will actually start January 1st. Well, understanding Medicare coverage. Well, your Medicare Part A, that's your hospital insurance, which is your inpatient care at the hospital. And then, of course, we have our Medicare Part B, which is our medical insurance. That's our visits to our primary care physician. And then we have the Medicare Part C, better yet known as the Medicare Advantage plan. And, of course, Medicare Part D, that's the prescription drug coverage. Now, the Medicare Part A, it covers hospital-related services and emergency care. Like we had mentioned earlier on, the inpatient hospitalization, home health services, skilled nursing services, as well as hospice. Please take note, Medicare Part A, it does not cover all of your hospital costs, and it does not cover long-term care. Well, Medicare Part B, that covers your regular medical care and helps with outpatient services. It covers your doctor's office visit, your laboratory services, your ambulance visits. It also covers all your diagnostic services. But it's really important that you realize all this, because most of the time, you think you're totally covered, and that's not always the case. Medicare does not cover all of the costs associated with hospital and medical insurance, and it does not include prescription drug coverage. Now, the next chart that I'm going to go over will certainly point out a few glaring things that could certainly open up your eyes to some of the out-of-pocket costs that you'll need to incur. So here is the Medicare out-of-pocket cost for 2024, which is the upcoming year. Your Part A hospital deductible. So this is what we're responsible for. So if we're in a hospital day 1 through day 60, we are responsible for the first $1,600 before Medicare kicks in and pays anything. Now, if for any reason we need to be in the hospital for 61 through 90 days, we are responsible for the first $400 per day. So if the cost is $489 per day to be in the hospital, we'll be responsible for the $400. Medicare will kick in and pay the $89. Now, let's hope we don't need to spend 91 to 150 days in a hospital, because that's $800 per day, and that could get real expensive. Now, as far as your Part B, which is your primary care physician visits and things of that nature, we still have our $226 annual deductible. And it's also important to know that based upon your income, for the most part, you're looking at a monthly premium of around $165. Here are other hidden costs of Medicare, and none of these things are covered. Prescription drugs, we already had mentioned that earlier on. Vision, I'll tell you, 4 years ago, I didn't need these. Old age creeps up on us. And then, of course, emergency care abroad, which I'd already spoken about. Dental, always got to take care of our teeth. And then last but certainly not least, hearing aids. My kids always tend to tell me, Dad, I think you need hearing aids. And I just tell them it's selective hearing. You have choices and individual needs vary. It's important to remember, when Medicare was established way back in 1965, it was never meant to cover all of your medical care for your senior years. It was intended just to cover only the most basic of needs. You have choices in regards to your health care, and of course you can stick with the regular Medicare Part A and Part B, or you can purchase additional coverage. And you can make this decision based upon your own unique healthcare needs. The two choices to fill in those gaps would be, of course, your Medicare Advantage Part C and the Medicare Supplement Insurance, better yet known as Medigap. Medicare Advantage Part C, the coverage is provided by a private insurance and is limited to a defined network of doctors and providers. So that's a common misconception, that people feel that the Medicare Advantage is actually a government-driven part of Medicare. It is not. It is provided by private insurance. It combines your Part A, hospital insurance, and your Part B, your medical care, and oftentimes it does include your Part D, which is prescription drug coverage. Medicare Supplement Insurance, better yet known as Medigap. It does cover those deductibles like the $1,600 to $400 and the $800. It covers many of your co-payments and your co-insurances, and it's designed to fill in the gaps that Medicare Part A and Part B just does not cover. So most of the times it's a little bit more of a comprehensive coverage. Well, here we're going to take a look at the two side by side of your choices to fill in the gap. Of course, we have on the left the Medigap, original Medicare and Medicare Supplement Insurance. It does have higher premiums, but again, you don't have any copays. You have the freedom to choose doctors, and there are no referrals necessary. And some routine services, they aren't covered, like vision and hearing. So that is one thing to take into consideration. And the one nice thing is you're covered anywhere in the continental United States, and 6 plans actually offer coverage abroad. Now, the Medicare Advantage plan, it's generally lower premiums, but they do have copays. It may be restricted to a network of doctors, usually within your service area. You may need referrals to specialists. And one of the real nice bonuses is it does include extra benefits like vision, hearing, and even a lot of times a fitness membership. Outside of your service area, you are only limited to emergency services only. So you do need to take that into account. If you do like traveling to places like what we have behind me, you might want to take a look at something a little bit more comprehensive and make sure that, God forbid, you get sick or you get injured abroad, that this insurance will actually cover you. One of the 4 secrets that we're going to go over today is the Medigap plans. They offer identical coverage. There are 10 Medigap plans, and each one is known by a letter. It's A through N, and 2 plans, F and G, actually have a high deductible option. For every lettered plan, every insurer that offers that plan provides the same exact benefits and services. The plans are regulated by the government, so the coverage within each lettered plan is the same, regardless of the insurer that you choose. That is regulated by the government. That means that all Plan A's have the same exact coverage. All Plan B's, Plan F's, and Plan G's all have the same coverage. You can pick the plan that has the coverage you want. You can compare one insurer to another, and you can pick the plan that has the best rate. Questions to ask yourself when picking a Medigap plan, the supplement plan. Well, first, what is your income? Using your customized Medigap report, you can shop for a Medigap plan that has the most benefits that will fit within your budget. Do you think you will or want or even need nursing care in your later years? I always say this, look at your family's medical history. If your parents or grandparents needed some sort of nursing care, you may also want to consider having that type of coverage because of your family medical history. I can tell you right off the bat, my mom passed away 2.5 years ago to cardiovascular disease, and my dad just this summer had a piece of melanoma removed from his face. I'm 0 for 2. So the chances are I'll be looking for something pretty comprehensive. So again, you want to take family history into account as well. Do you travel a lot overseas? If so, you can get a coverage for emergency care in foreign countries with Plan C through G, M and N as well. Deciding between the different types of Medigap plans. Obviously, we're going to pay a little bit of a higher monthly premium for the more comprehensive coverage, or you can sort of take some of that ownership on yourself and pay less for your premium, and with the chances of potentially paying a little bit more out of pocket. Here's a great graph of plans A through N. As you can see, Plan F and Plan G have the most comprehensive coverage. And then you have Plan A. The coverage isn't as comprehensive, but you may not be traveling a whole lot, or you may not be overly concerned about the Part B excess or anything of that nature. Well, at that point, A might be a good point for you to start. Again, you might want to take a look at the bottom here. The annual premiums are a lot cheaper than your Fs or your Gs. Secret number 2. Medigap plans are standard, but their rates are not. Remember, we spoke about that. The government mandates that services be identical across the board in each lettered plan, regardless of the insurer you choose. The only thing the government hasn't mandated is how much they can charge you. Insurance premiums can vary thousands of dollars a year for the same exact coverage. So what we're going to do is we're going to go over an example of a 65-year-old female, a 68-year-old male, and then we'll also run it for a couple. Here we have a female age 65 living in Shanlahan, Illinois. And I ran the coverage on Plan G, which is the most comprehensive coverage. The Plan G's highest premium from an insurance company was $4,493. That same Plan G on one of the lowest insurance quotes was $1,518. That's a savings of almost $3,000 a year. Now, I do want to point out the highest Plan G premium, that was the United Healthcare through the AARP. And this Plan G was through the Oxford. So again, the services in each plan are identical, but they're not mandated to charge a very specific price. So pricing varies. So this person, if they went in to the Three Rivers Public Library system and they actually ran a Medigap report and they felt like the most comprehensive coverage, Plan G, was appropriate for them, they could have saved themselves a lot of money instead of watching infomercials on TV. Here we have a 68-year-old male living in Shanlahan, Illinois. And of course, we ran the Plan G, the highest premium, which was also, again, the United Healthcare through AARP. We'll just call it ARP. It's a lot easier. $5,067. And then I also ran a Plan G on one of the lowest premiums. And again, that was the Oxford at $1,716. This gentleman actually saved $3,351. Now we have a couple age 65 and 68 living in Shanlahan, Illinois, and combined, the highest premium for Plan G was $9,560 a year. That, again, was the United Healthcare through ARP. That same Plan G through Oxford was just $3,234. This couple saved $6,326 for the year. Now I'm going to talk about three things off topic here. Now, one of the three things can definitely happen, and I hope it does happen for everyone. We knock on wood that once we hit 65 on Medicare years, that we get an opportunity to at least live 10 years through Medicare. So that's to age 75. Those are real possibilities. Now, the next two are not real possibilities. And number two is there are no raises in the premiums each year for 10 years. The chances of that happening are probably nil. Insurance companies like to raise their rates all the time. And then, of course, number three, that inflation stays flat. And we know that the chances of that happening are not even zero. It's probably minus 100. But let's just say that we hit the perfect world where we had no inflation for 10 years, no rise in premium for 10 years, and we actually lived 10 years through Medicare. The simple fact that this couple shopped every single year on the lowest, because obviously we're going to get inflation, obviously we're going to get a rise in premiums, this couple would have saved over $63,000 in that 10-year time horizon. That's a mid-size luxury car, and I would much rather my grandparents drive around in a big mid-size luxury car than just go with a company just based upon what they maybe have seen on television. How safe is your insurer? These are also important things to understand. At Weiss, we make things super simple. We use the traffic light model. If it's green, that means we're very much in favor. And for us, everything that we rate, whether we give buy, hold, or sell recommendations on stocks, mutual funds, or exchange traded funds, or we give financial strength ratings for banks, credit unions, and insurance companies like this, we do everything on a fundamental basis. Everything is ran off of numbers. There is no hypotheticals with Weiss Financial Ratings. We're not worried who's a takeover candidate or who's the new CEO or if there is a new CEO coming in. Everything is based off of the numbers. And if the numbers fall in line, that is where we make our recommendations. And obviously, green means that the numbers were there, we like the numbers, and we highly encourage you to either do business with that company, or that might be a company that you may think about purchasing or doing business with. Now, if it falls into yellow, which is for us in the world of traffic, that's the caution. That doesn't necessarily mean run to the company or run from the company. It just means that the numbers didn't necessarily fall where we like them to be. So we just would rather you be a little cautious before stepping in. And then obviously, last but certainly not least, is a red light. And for us, that means that the numbers were not favorable. We highly recommend that you look elsewhere. In the words of Tom Hanks, run, Forrest, run. It's just the numbers aren't there. Secret number 3, safer insurers are not necessarily the most expensive. Now, I'm going to also share something with you that's probably going to shock you. I showed you some examples of a 65-year-old female, a 68-year-old male, and then the couple. And 2 of the companies that I put in there, one was the United Healthcare through AARP, and then you had the Oxford plan as well. Now, when we took a look at those numbers, and I'll back up if you don't mind. So there's the plan right there. Really, when you take a look at the highest premium, $9,560 through the United Healthcare through AARP, and then the $3,234 through Oxford, you're actually paying almost a third of what the highest premium was. And I bet you probably feel that the Oxford has a weaker financial strength rating than the United Healthcare through AARP. Well, I'm here to tell you that probably 50% of the time, it's the polar opposite. The United Healthcare through AARP is actually rated a safety rating of C. And the Oxford plan is a B+. So not only by shopping are you able to save almost 2/3, but you're also doing business with a more financially strong company as well. So I did want to point that out to you. Higher premiums do not mean you're getting coverage from a stronger, more financially stable insurance provider. And the last secret is you can make the choice. The choice is always yours. More coverage for less. Reduce your premiums. Balance the financial safety of your insurer with your choice of plan. And these are the 4 secrets that we spoke about today. Medigap plans offer identical coverage. Medigap plans are standard, but as we see, the rates are certainly not. Safer insurers are not necessarily more expensive. And of course, last but certainly not least, we always can make the choice. Weiss Financial Ratings, the Medigap report that you can download for yourself. It'll help you make the right choice for you in your specific situation. You can pick the right coverage. You can pick the lowest rate. You can save valuable time and money. You can pick the best and most affordable plan from all available providers, customized just for you. And you get all of this for free just because you are a patron of the wonderful Library of Three Rivers, and they subscribe to this fantastic tool to allow their patrons to go ahead and shop and save time and money. Here are some common questions that I get throughout my presentation, so I sort of get them out of the way before we even begin. And one of the common questions is Plan F and Plan G. Well, they discontinued Plan F, and people ask why. Well, if you were eligible for Medicare after January 1st, 2020, Plan C, Plan F, and high deductible Plan F will not be available to you. If you are eligible, obviously, prior to January 1st, 2020, you can continue to enroll in Plan C, F, and high deductible F. In essence, you were grandfathered in. Well, if you're not eligible for that Plan F, C, or the high deductible Plan F, consider Plan D instead of Plan C, or Plan G instead of Plan F. The only difference is the $233 Part B deductible, and there is an error there. It is actually $226 for the Part B deductible. And I will tell you that when you take a look at the difference between the premiums between Plan F and Plan G, Plan F's premiums are typically a little bit higher than Plan G. So therefore, that $226 really only comes down to a difference of maybe $60 or $70 a year. Probably not even enough to fill up your gas tank. So why give yourself a headache of getting aggravated of not being eligible for the Plan F when it really is only a difference of $60 or $70 for the year? Why the government changed that? It's anybody's guess. The solutions offered by Weiss Financial Ratings Customized Medigap Report is to help you find and select the best Medigap policy for you with the strongest companies and, of course, for the least amount of money. Naturally, every person's situation is very unique, so if you have more questions, these are some of the things that I urge. I'm going to give you 4 bullet points instead of the 3 that are there. The first and foremost is talk to your doctor. Your doctor will know really, where you are healthcare wise and what maybe some of your future needs are. And they might be able to help you select a plan that's most appropriate for the needs that you'll have for your care going forward. Now, the second bullet point that is not on here is while you're in your primary care physician's office, not only speaking to your primary care physician, talk to the office manager. The office manager always knows what insurance companies are easier to deal with, which ones provide the quickest approval for procedures that need to be done. And I always say this, if you go in and the doctor finds something and they want to do some tests, some preliminary tests to find out, really the last thing that you want to do is do business with a company that you're waiting for an answer for a week or so from somebody sitting in a cubicle making decisions. Your office manager knows the insurance companies that give the approval right off the bat so that, it's something that's not weighing on your mind for a week or two. It's something that you can schedule out and take care of ASAP. Office manager is always the best resource. They know what insurance companies pay on time. They know what insurance companies are easier to deal with. They are such a great resource. The third bullet point, talk to your insurance company that you've selected. Make sure that all of your questions are being answered. Make sure that if there are several countries that you like to visit very often, I can tell you that for my family, Sicily is an area that we visit very often, as well as Jamaica. And you know what? That would probably be very important for me to ask the insurance company. If I am in any part of Italy or if I'm in any part of Jamaica, am I covered? Also, prescription drug coverage. If you don't have prescription drug coverage, some of these companies, most of these companies actually offer a prescription drug coverage, even with vision and even hearing, for a very low price. It doesn't hurt to ask that insurance company if they provide prescription drug coverage. And if not, do they have a plan that's inexpensive but gets the coverage that you need? And then, of course, the last bullet point, these are what I call the marksmen. These are the experts in regards to Medicare, and those are your SHIP counselors. They are the State Health Insurance Assistant Programs counselors, and you can give them a call and reach out to them to get personalized one-on-one Medicare counseling, either over the phone or in person to help you further. You can locate a SHIP counselor in your area by visiting the website www.shiptacenter.org. and click on the Find Local Medicare Help. Now, a lot of public libraries actually have ship counselors that, come in and sit with their seniors in their area, or town halls typically will have ship counselors come in. They live and they breathe Medicare all day long. And it's also great to work with a local ship counselor because many of the local ship counselors know many of the insurance companies that are capable of writing policies in your zip code. And they'll be able to also let you know which ones are very easy when it comes to underwriting. They'll also let you know ones that are a little bit stricter in the way of underwriting procedures. Well, how do you get your own Medigap report? Well, you can go to the Three Rivers Public Library website at trpld.org. And right at the top, you're going to click on Resources. And right under Resources, you'll see Online Resources, and then just select the letter W, and you'll see Weiss Financial Ratings right there. Just click right on Weiss Financial Ratings, and as long as you have one of those Three Rivers Public Library card with your library card number, you can get in. One of the nice things is if you're visiting your public library, which I hope most of you are, you can actually just sit down at the computer and you don't need your public library card. You'll have instant access to the Weiss Financial Ratings database while you're in the library. But if you're home, whether it be a smartphone, a tablet, a laptop, or even a desktop, you'll just need to have that Three Rivers Public Library card number to be able to gain access to this database through the Three Rivers Public website. And last but certainly not least, I would be remiss if I did not thank everyone for joining us today. I am actually going to pull up a Medigap report for you so that you can see on how easy it is to run a report and what it actually looks like. And then what I'm going to do is I'm going to open it up to questions. And even more importantly, hopefully everybody has an opportunity to run their own Medigap report, maybe today or another day. And if you have difficult time doing it on your own, again, remember you have reference librarians right there in Three Rivers Public Library like Luis that can certainly walk you through on how to do this. I'm telling you, it is an opportunity for you to actually, one, get very educated in the way of Medicare, and number two, really give you a great opportunity to save thousands of dollars. So I'm going to go ahead and I'm going to stop sharing my screen here. And what I'm going to do is I am going to escape from this. There we go. And I just want to make sure that everyone can see the screen. Can everyone see the Weiss Financial Rating screen?
Yes.
Awesome. Now, I do need to let you know I have an admin look to the page. Most of you will actually see a page that looks probably very similar to this. So I'll bring you to a more familiar looking page. There we go. And although you have all of the tabs up here that are available to you, there is the Medigap tab, but you also have it down here where you could click right on Medigap plans. And it brings us right here. And here we have our first name. I don't know, can you guys see this at all?
Yes, we can.
Okay, great. I just know that when I actually run the PDF, I'll just have to stop sharing and go to the PDF because it pops up in a different technology. But know that while you're on the database page, you'll be able to see it on your computer. So here we have the first name, last name, email address. We have our age, gender, and zip code. One thing I did want to point out, there was that video I was telling you about. You could just click on that video if you wanted to see this presentation again, if you didn't want to go and see my recorded presentation with the palmetto trees and the green C. But at the bottom here, I wanted to point this out to everyone. We do take your privacy seriously. Your name and email address, they're not collected for any purpose whatsoever. If you prefer, you can enter your initials above. When you do enter your email address above, a copy of this customized report will be sent to you. If you'd rather not receive a copy and you just want to be able to read it online, just simply put ignore@grayhouse.com. Now, what I'm going to wind up doing is we'll just call ourselves a sample patron. I don't need this, so I'll just do ignore@grayhouse.com. Now, the three things we can't ignore. We can't ignore age, because as we get older, we get a little more brittle and premiums typically go up. And gender is something that we can't avoid either, because Luis and any of the young ladies that are joining us here today, insurance companies and many people feel that you live much longer than us males and that you typically take a lot better care of yourselves than we do. And I will tell you, sometimes there's a lot of merit to that. And you typically get cheaper premiums than us males. And then, of course, zip codes are very, very important, because obviously a physician in Shandalon, Illinois, is charging a lot differently than they are here in a metropolitan New York area. So that's also going to affect premiums. So we'll just run one right now for a 65-year-old female. And I believe your zip code is 60410. Am I right? Yes?
Yes.
Awesome. My memory serves me well. And then all I do is get report. Right about now, what it's doing is it's pulling every single insurance company that is capable of being written in zip code 60410. It's pulling up their safety rating. It's pulling up their monthly premium. It's pulling up the annual premium. And it's also pulling up the contact information so that if you select one and you want to get that quote in writing and possibly bind, that you can immediately go and make that phone call on the spot. Usually only takes a few moments before it pulls up. And once it pulls up, I'll go ahead and show you the PDF that it provided to us. Now, the whole first half of this report is actually great information. Now, are we sure that it was 60410?
Yes.
Okay, because for some reason they're telling me that they're having a difficult time pulling that up, and that usually happens when I don't put in a good zip code. And I certainly hope they're not updating everything right now, because then that means that we might not be able to pull it up, but I have it, so it doesn't matter. So we are 60410, and let's try this one more time. Because normally it only takes about 15 seconds to pull the report. So they might be updating the reports with either new companies that were added to the zip code or numbers for the premiums. Premiums tend not to move all too much on an annual basis, but usually right about this time is when they start updating things. And it's usually right in the beginning of the month, and we are on the 2nd. So I'm having a feeling this might be the case. That is the case. So let me go ahead and let me just show you. I'm just going to show you one of these reports here. And I'll pull one up that's not too far from you. Here we go. Okay, so let's go back to Zoom. And we're going to go ahead and we're going to share this. So I'm going to go ahead and I'm actually going to show you a report. Can everybody see the report?
Yes.
Okay. Well, for some reason, it's okay. Well, let me just get rid of some of the things here because I don't need this. So now we see that we have a sample patron, a 65-year-old female in Plainfield, Illinois, not too far from you guys. I ran this actually on September 15th of 2023. And as we scroll down, just so you know, I told you the whole first half, which Medigap plan should you choose? We have the full educational piece here as we go, decision 1, decision 2. And then, of course, we go into everything that's covered and what's not covered. And there's not much that we don't go through. Here we have inpatient care, what Medicare takes care of and what we're responsible for. Skilled nursing facility care and hospice. And of course, we have our wellness visits. We have our bone mass measurements and breast cancer screening, as well as cardiovascular disease screenings. Really not much that we don't cover. But what I wanted to do is I wanted to go down and I wanted to actually show you what the report actually looks like. And if we were looking for a plan A, let me just get down to the plans because this is a pretty robust book in the beginning here. It's about 80 pages long. And typically, there we go. And here we go. This is the Plan A's. And this shows us all of the companies, their safety ratings, their annual premiums, as well as their monthly premiums. Now, if it says NA there, that means that they just didn't tabulate the monthly premiums. All we do is take the $1,118 and, of course, just divide that by 12. Now, one of the things I did want to point out is we did go over the Plan G, and I just wanted to go down to Plan G just so that we had, all right, now we're on Plan C. I just wanted to go over the Plan G. And there usually is a table of content over to the left here, but because I'm pulling up a report from a couple of weeks ago, I'm not able to do that. I am sure that this will be up and running within the next hour or so, that you'll be able to pull your own reports as well once it's updated. Well, there's Plan F. Next we have is Plan G. Okay. Well, now Plan F, high deductible. And here we go. And there is Plan G. Now, Plan G, there are all the rates. And of course, Oxford still really wasn't the cheapest. There's the $1,518, just $131 a month. There's that B plus safety rating. Really, SBLI USA Life Insurance Company was the cheapest at $1,332. But out of the two, most people know Oxford. Oxford is one of the larger insurance companies in the country. And there's that B plus rating. And of course, you have Blue Cross Blue Shield. Everybody knows Blue Cross Blue Shield of Illinois. And they're at $1,514. Now, I did want to show you that United Healthcare. And there is the double asterisks that show policy sold only through the AARP. And as we scroll down and we look for the United Healthcare Level 2, my eyesight is not all that great, so I apologize that I'm moving slow through this. There's the select. We're not looking for select. There it is right there. The United Healthcare Level 2. There's the double asterisk for the AARP. And there's the $4,493 and a monthly premium of $374. And even more importantly, outside of going through Oxford and paying a third, or Blue Cross Blue Shield and paying a third, their safety ratings being a B plus. United Healthcare through AARP has a C rating. Now, that's not saying run away from United Healthcare through AARP. I'm just simply stating a fact that, that's exactly, you know, the difference between safety ratings and pricing. And usually, sometimes safety rating doesn't play in line with the pricing. And then, of course, last but certainly not least, we have a listing of all of the companies that are on this report. And if we will look at them, there's the safety ratings, the telephone numbers, and of course we were looking for the Oxford. So we'll scroll down for the Oxford, and there's the Oxford Life Insurance Company, the B plus rating. They are licensed in all states except for New York, Vermont, and Puerto Rico. Boo, we can't get it here in New York, but there's the number. You could give them a call and you can go ahead and you can get covered and probably bind insurance on the spot if you wanted to. I always recommend trying to select 2 or 3 companies. And then once you select the 2 or 3 companies, of course, speak to your primary care physician. And then after that, it's always a great idea to talk to the office manager there and then call the companies and ask all the vital questions that are important to you. So with that being said, I am going to open it up to any questions one might have.